Ayla. So just here today to do a pre-exercise just screening tool, just to go over everything. Okay, so the purpose of doing this is just to get as much medical information about you as possible, just by asking a series of questions. Why we do this? We just need to try and identify any contraindications to exercise. So a contraindication can be anything that is present that can be potentially harmful to you while exercising. Okay, so it can be something as little as a sore ankle or something as serious as like cardiovascular disease. Okay, so we'll go over stage 1, then we'll continue over to stage 2. And then that'll identify what kind of exercises you can perform and at what intensity. So yeah, I can put that into a program after I identify that. It can also determine if we need to send you to a doctor to get medical clearance as well. So we'll just get started. So stage 1, so I'll start by these questions. So has your doctor ever told you that you have a heart condition or have ever suffered a stroke? No. Do you ever experience unexplained pains in your chest or at rest while during exercise? No. Do you ever feel faint or have dizzy spells or spells of dizziness during exercise that cause you to lose balance? No. Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months? Perfect. If you have type 1 or type 2 diabetes, have you had trouble controlling your blood glucose in the last 3 months? Okay. Have you been diagnosed with muscle, bone or joint problems that you've ever been told to make worse exercise? No. And do you have any other medical conditions that may make it dangerous for you to participate in physical activity exercise? No. Perfect. Okay. So since you've answered no to all these questions, we can continue going over to page 2, stage 2. Okay, so we worked this out. So your age is 23 and female. Okay, so that makes you at no risk factor. Number 2, do you have a family history of any heart disease? No. Perfect. Do you smoke cigarettes on a daily or weekly basis? No. That's great. So describe your current physical activity exercise level. So sessions per week that you do.
So roughly 4 to 5.
Yep. Okay.
And altogether about 210.
Yep. Okay. Perfect. So that makes you at a -1.
Mm-hmm.
Okay. So that's perfect. So if you did any exercise that was below 150 minutes, you'd be at risk. So that's perfect. Okay. So we worked out your BMI earlier. Okay. So it's currently at 32.5. So that makes you at a +1.
Mm-hmm.
Okay. Now number 6, have you ever been told that you have high blood pressure?
No.
Perfect. Have you ever been told that you have high cholesterol? Have you ever been told that you have high blood sugar? No. Just a couple more questions. Have you spent time in hospital for any medical condition during the last 12 months?
No.
No. Are you currently taking prescribed medications for any medical conditions?
No.
No. Are you pregnant or have you given birth within the last 12 months?
No.
No. And do you have any muscle, bone or joint pain or soreness that is made worse by particular types of activity? No. Perfect. So that leaves you at a risk factor of 0. So that indicates that you can perform vigorous or high exercise.
Awesome.
Perfect.